outside.
We're back hanging out with Jen Fanning of Grand County Rural Health Network, and we're talking rural health, the challenges we face, and services you provide. So, let's get into a couple examples of some ways that you directly affect, some of their lives locally. And I know we talked about Patient Navigator. So what is Patient Navigator? If I'm a patient, first of all, how am I going to even find out to come to you? We kind of touched on that a little bit, but
sure, absolutely.
Take me through the steps, all the way into using.
Absolutely. So I'll give you an example of a fictional person.
Sure.
However, pieces are very real, right? So somebody is sick. They're just kind of feeling really tired, whatever. They get a voucher, a pains voucher.
And how do they get that pains voucher?
To go see a doctor. They might call the doctor and say, I'm feeling sick and blah, and I want to, I don't have insurance.
Oh, okay. So they can
The doctor asks a couple of questions about, okay, financially, where are you? How many people are in your family?
Sure.
Okay, you qualify. Come on in. We'll use this pains voucher. So then they get diagnosed with diabetes, for example, through the pains voucher. There was some blood drawn, perhaps.
So it's not just an antibiotic and it's over. There's going to be more.
Right. We pay for certain things. We help figure out other ways to pay for certain things. But so then they get diagnosed with diabetes, and
this is like a free voucher, discount voucher.
Kind
of everything, depending on what your income levels are.
Depends on what your income. Yeah, we don't require people to pay, but we always ask for something because people always want to give what they can. So they get diagnosed. Maybe they're low income and just completely overwhelmed. Maybe it's somebody who already has heart disease, for example. So they're like, oh my gosh, how do I handle this? I've got to deal with specialists. I don't know how to do this. How do I do?
There's the things you should be doing and things you think you can afford to do.
So
and
confusing.
It's not always the
Where
same.
do I go in Grand County? I can't get to the specialists in Denver. And so the doctor says, why don't you call the Patient Navigator? Our Patient Navigator is Maureen Weier. We also have work really closely with Middle Park Medical Center, and they have a Patient Navigator there, Maria John Deddy.
And you find these, are they on your website?
They're
or do you
on
call
our website,
3477 number?
Yep, you can, again, call any doctor.
And Maureen is a nurse?
Maureen is a nurse. They are both nurse navigators. And we chose nurses specifically based on community feedback that, people need help navigating the system. So, for example, this person, Joe, let's call him Joe, is trying to figure out how to handle his diabetes and doesn't have insurance and doesn't have the income to pay for insulin. So goes and talks with Maureen. Well, Maureen can take some time with that person because she's a nurse and she understands the science behind it. She can provide significant education about what diabetes means and how it interacts with your heart disease and what that means. And okay, here's what the insulin does, and here's why when you don't take your insulin,
just help to
you
educate
feel this
you
way. Right, and here's some tools to help you manage it yourself. And okay, you need help getting to the doctor, let's find you transportation. Oh, and you need help.
So she could really kind of organize everything you need that you're overwhelmed with.
Magic worker.
Yeah.
Magic worker. I mean, I am not kidding. And she doesn't necessarily do this with every patient, but some people, we have a lot of traumatic brain injuries up here because we are so active and hit our heads, skiing or biking or, whatever that looks like. And so specifically for people with TBIs, she can even go with the patient to hear what the specialist is saying.
So she can actually translate for them.
Right, exactly, and be their advocate. And she is the advocate, and she can communicate with the specialists and the primary care providers and make sure they're talking.
So this is way more than just, here's a couple good tips to do on your own. See ya, one time and one and done.
Especially if somebody has multiple diseases and they're on all sorts of different drugs. And ideally, the primary care provider is managing that, but the primary care provider doesn't always know where the patient is going and what meds they're on. And she gets all that, and she can be like, oh, this interacts with that, and this is probably causing symptoms that is why you're on this drug.
This is a service that is available to all of us, no matter what your income level is.
Yes.
I mean, you can get help through the Grand County.
Absolutely.
So you don't necessarily need to be broke. You might just be overwhelmed, confused, and don't know what to do. I mean, that's what's so great about this, is that it's from the lowest income to the highest income. If you feel overwhelmed and don't feel like you've got a great grasp of what's wrong with you, you can get that help. So.
It's confusing for those of us that are very familiar and educated on the healthcare system, let alone people who are busy doing other things.
All right.
Absolutely.
It's break time again. Time to go watch a few local ads. I'm hungry, so hopefully there's a food one. But when we come back, we're going to talk about open enrollment. It is that healthcare time of year when everyone's got to know what to do and make sure to do it on time. So once again, we're hanging out with Jen Fanning of Grand County Rural Health, and we're going to talk open enrollment and healthcare after the break here.
Sounds great.